Hello, everybody. Good morning, good afternoon, good night, wherever you are. My name is Gustavo Bezerra, and I'm here representing my group of colleagues from School of Medicine of University of Fortaleza, located in Fortaleza, Ceará, Brazil. I'm going to talk today about our research, which is about telemedicine application and assessment during the COVID-19 pandemic. So this is a summary of our presentation, which is divided in 5 parts. And first of all, I'd like to start with this question here that many people may ask: that what is telemedicine? According to the World Health Organization in 2016, telemedicine is the delivery of healthcare services where patients and providers are separated by distance. Okay, it looks like a simple concept, right? But telemedicine has a big form of appliance like tools or services or even people. As we can see here in this table, it can be used from clinician to clinician, from clinician to patient, and from patient to mobile health technology. And it also can be used uh, through many tools like video or email or mobile apps, smartphones, or even games, and many others. And it also can be used in many forms for many objectives, like some specialties like dermatology, radiology, ICU, or medication management, wound care, monitoring of physical activity or diet, uh, many forms of healthcare, in fact. And as you may know, the COVID-19 pandemic reduced substantially the typical face-to-face appointments. And with this necessity of adaptation, there's been a much greater use of telemedicine, as the example of news here shows us. This title here: telehealth visits surge along with coronavirus cases, and it also can be shown in numbers here in these graphics I brought to you here. This one in the left is the telemedicine utilization by US hospitals during and after COVID-19 as of April 2020. And this in the left here says that at least 19%, this total here, uh, showed a change of the utilization of telemedicine compared to the historical levels. And this one in the right shows the projections for the future. And at least 19% whether maintain the increased use or will increase use further. So we can see that, in fact, there has been and will be a growth in the use of telemedicine. And not only in the US, but also in other countries like ours, Brazil, there has been a growth in telemedicine with the pandemic. So these are some medical enterprises from Brazil, and these bars shows us, this white one here is the number of telemedicine visits before COVID-19, and this blue here is during COVID-19. And we can see here that all these enterprises experienced some growth, reaching even 2,400% of growth in this pandemic compared to before. And also some perspectives for the future. This topo review here is a report with the objective to prepare the healthcare workforce to the digital future. It's been made by NHS from UK in February 2019, before the pandemic, right? So it shows us, it says that telemedicine is the top of, of healthcare technologies, and it also has a big projected impact from 2020 to 2040, as we can see in this graphic. And now that we've talked about a bit of how telemedicine works and how it has increased. I'd like you to see some points of our research that we made. It was a systematic review, and we started with the research question that how was telemedicine application and its feasibility during the COVID-19 pandemic? And from that, we went on PubMed and we were looking for articles with both telemedicine and COVID 19 themes from April 2020 to April 2021. And the total of studies we found with these terms of research were 3,327 studies, from which we excluded 3,309 because they weren't original articles. And in the end, we analyzed only 8 studies. We excluded some more because whether there were no full text available or they were irrelevant. But in the end, remained 8 studies only for us to analyze. So in these 8 studies, we found some interesting results, and one of them is that a big variety of medical specialties were embraced, like oncology, pneumology, rheumatology, general practice, geriatrics, and psychiatry. And some of the main results, and one very important, is that all of the studies that evaluated the satisfaction of patients with telemedicine showed a satisfaction rate above or equal 90%. And also, some of them showed that the inclusion of remote visits would increase also the participation in future trials. And in most of these studies, telemedicine had good points, like the reduced risk of infections and the no displacement needed to go to the medical appointments. And when I say that, I mean traffic or time wasting to get to the clinic. But on the other hand, there were some limitations with the use of telemedicine, like the internet connection, the technological skills, and the privacy required to go to the telemedicine appointments from both the clinician and the patient. And discussing these main results, we had a positive evaluation in all the studies, and also positive results in many areas of medicine and many modalities of telemedicine or telehealth. Okay. And in most of these studies, they showed us some good and practical examples of how to provide effective remote care and can be applied in many future settings. Okay, and also there are many branches of medicine affected by the pandemic, as you all may know. Uh, and some studies call uh, we can call it the post-COVID-19 syndrome, which will require multidisciplinary attention. And certainly, we think telehealth is a tool that can be applied in different clinical settings and can be useful to overcome this post-COVID-19 syndrome. And finally, I like to conclude saying that our research found some benefic effects of telemedicine. And so we think that innovation and adaptation may be the key for success in healthcare. And we believe that telemedicine is a very important example of innovation and adaptation required. So these are our references used for these slides, and all the 8 studies we've included in our systematic review, if you want to see. Okay. Muito obrigado. Thank you very much for this big opportunity for the attention on behalf of the my whole team, and I'd be glad to answer the questions you might have. And goodbye.